Everybody, it's me. It's Dr. Kessler from Lyon County Community College with today's co-video. Quick announcement, I'm going to be not producing a co-video tomorrow on Sunday. I'm going to do as the governor, Mike DeWine, in the state of Ohio is doing and take Sunday off. Um, but I do have a few things to talk about today. I'm going to start with, as I always do, and that is my temperature. I am 96.3 Fahrenheit and 35.7 degrees Celsius. All right. So I want to start with something here that shows you how hard we've been working and why we are working at what we're working on, and that is keeping the hospital count down is helping people. And you can see where this is a plot of death to hospitalization. And what this shows you that is if you are showing symptoms, if you have problems, you need to get to a hospital, and if there is enough capacity, they will take care of you. And you're going to see lower deaths. The more people you put in the hospital, the better off we are. The more capacity to put people in the hospital, the better off we are. You can see that even in places like New York City and New York, where they have they've been working hard nonstop to keep people to get people taken care of. They are doing very well with respect to mortality. That's kind of where I'm going to talk a lot about today, is about mortality and try to figure out what it is that's going right and what it is that's going wrong and how can we do things better. I think that if we can keep the hospitalizations down, I think it's very important for people to stay home. I think it's very important for you to stay home. That is the best thing you can do to help each other, to help the healthcare people. The healthcare people at the front line need your help. And so you want to make sure that we do good by them. So you can see here in some places in Texas, they have a very high number of deaths. But low hospitalization. That means you need to get into the hospital, and that's going to help you out a lot. That is keep up the good work. We need to double down. We're heading into the worst of it, and we will come out. That much I'm sure of, I'm certain of, and I'm going to get into a little bit about that later on. I think that one of the things you can look at is you can look at China. And China is a place where things are going, I think, well. But I'll have more to say about that in 2 seconds. First of all, what is it? What is this whole disease? What is the problem that we're talking about here? And it's a storm. You've heard me talk about the storm that is brewing, the storm that is coming, that is COVID-19. There's also a storm that happens within inside of us. And that's what we call a cytokine storm. And what a cytokine storm is when your immune responses go all wacky, and you get all kinds of chemicals that are sending signals about everything. If you think about your immune system as a symphony, there's a lot of players, there's a lot of orchestra members, and you've got to keep them tamed. What we know is that the people who have the most amount of trouble are the people who are going through these cytokine storms. These overimmune responses. The problem with taming the immune system, it's complicated. And you can't just apply a one cure fits all, because sometimes you have chemical messengers that communicate different messages. The same ones can communicate a different opposite message. And so you got to be careful. Well, do I want to bring it up or do I want to bring it down? It's a very complicated story. You don't want to eliminate the immune responses at all, because obviously you're facing an infection here. So it becomes very complicated. This is why we have to put people in hospitals. This is why we need hospitals for the people who are going through these kinds of things. And that's why we have to keep the hospitals open for the ones that do need it. One of the things I can tell you is about looking at the numbers, and if you've looked at the numbers, you've seen that the German deaths are very low, and we talk about a death rate, and it's really quite low. It's about 1.41, which is a very low death rate. And so the German experience is very good, ist sehr gut. And why is that? Well, there could be a lot of reasons for that. What is the reason? Was ist das? Is it good health? Is it gute Gesundheit? Are they better clinicians? Well, healthcare is very good in Germany. I will tell you this. One of the things I can tell you is if I ever need a bone marrow transplant, I'm going to Germany because everybody in the whole country is on the bone marrow registry. And I don't know very few people that are on the bone marrow registry in this country. I am, my wife is, and I think that's about it. So they really think healthcare is a very important thing. Are they better at public health? Well, yeah, I think they are better at public health. Public health is, tracking people down and making sure that they do the right thing. The social distancing is a matter of public health, and public health does work if it's applied correctly. Are they healthier people in general? Some people argue that maybe the Germans had a better experience because their younger population got exposed first, and they were able to sequester the older people away from the younger people, and maybe that's it. Or maybe, just maybe, they're better at testing. And they certainly are better at testing. They are doing more testing than anybody else has. And you might say, well, what does testing prove? What does testing do? Testing allows you to make very, very smart decisions about where to put people and how to do things. It also gives you a very accurate number. So maybe we all have the same. It's just that the rest of us are lousy at testing. And so I kind of played around with this a little bit. And by the way, we know, for instance, that governments are not always on the up and up with the information. We know that the Chinese government suppressed the number of cases. You don't see accurate numbers in the United States, and I think that's mostly because of the lack of testing. What if there were actually more people that are infected than we knew about? And it sure would be nice to know who they are. It sure would be nice to know that. That's one of the reasons why expanded testing is so important. Because we need to know who is infected, who is not infected, and who is infected but yet cured. You've heard me stress this several times on this whole thing. So I decided to look at something in a little bit more detail, and that is I decided to take the number of deaths. The number of deaths is a very hard endpoint, just to put it very clinically, I guess. It is a very easy thing to measure. And it is not one that is easy to suppress. So if somebody is suppressing data, the death data usually is very difficult to suppress. So if you look at the deaths, I have listed the deaths from Italy down to China here. And then I have the listed number of cases. These are the cases that have been described either through testing or excluding other diseases and including the COVID-19 as the possible answer there. And we can see that as you go across all of these populations from Italy to China, you have a crazy mortality rate. And the mortality rate here I'm calculating as the number of deaths to the number of cases and measuring the percentage. And you see that, in Italy, it's astronomically high. In China, it is, a little bit lower. In Germany, it's extremely low. And the question is what does that mean? Was ist das? What is the reason for that? Well, what if I were to take, and I did a little bit of a just calculation this morning because I got obsessed with it while I was drinking my coffee, and I calculated this. I said, what if we assumed a 1%, a 1.41% mortality rate? What would it look like? And I looked through the data, and that would mean like 1 million people are actually infected in Italy, not the 14,000. It would mean that in the United States there is a 500,000 people infected with the virus, not 300,000. There's not a big difference there. And in China there would be 235, almost 3 times as many people in China than are currently listed. And that would be a big difference there. All right, that's all for today. One of the best things you can do to be a helper, if you want to be a helper, you want to look for the helper, I'll tell you who the helpers are. The helpers are the people who stay at home. The helpers are the people who are not going out and getting exposed. I have heard anecdotally many cases of people, I was exposed to somebody, and 4 days later, they actually had COVID-19. They had it in the healthcare setting. It was a healthcare worker who acquired it from a coworker, and then had it 4.5 days later. They acquired the disease. So staying away from people is a good way to keep you from going to the hospital and using up the hospital resources. That's what it's about. So I want you all to be good to each other, and may you all persist like a lentivirus. We'll see you again on Monday.